So let's talk a little bit about the copy forward process to make you understand the how and the why of what we're doing here. First off, what do we mean when we say copy forward? Well, copy forward is a functionality in Alta that allows us to bring in previously entered data into the current note. Now, what types of data are we talking about here? Well, the most basic type is dealing with patient history, whether we're talking about the surgical history, family history. These are things that might change every once in a while, but don't tend to change that much from visit to visit. And unfortunately, Alta's never really given us a good way of maintaining this kind of information, so we put a lot of patient history information into the copy forward process. But another data type we have is looking at periodic screenings, whether we're talking about some of the yearly Joint Commission questions or finding a way of storing the preventative health information in Alta. Alta's never really given us a good way to store this before, so we've incorporated a lot of that into the copy forward process as well. The last big category of things we have are what we call chronic care plans. These would have been kind of a cover or a flow sheet if you were looking at the old style paper charts. For example, a patient that has diabetes, you would generally have a cover sheet on their chart that would show what's their A1C goal, when was the last time it was done, what is their LDL goal. So just some basic information about the patient's disease process that you could quickly review as you're seeing the patient that also wouldn't change necessarily that much from visit to visit. So you wanted to locate it all in one place to give an easy way to look at it. Alta doesn't really have any functionality like that, so we've created what we call chronic care plans in Alta, and these also copy forward from visit to visit. So how can you identify the fields that copy forward? Well, here's an example screenshot from our core AIM form. We've marked each of the copy forward boxes in yellow, and as you see in the box in the top of the screen, we also will sometimes put a CF tag on there to show you things that copy forward. You'll find that mainly on the Exit/CCP tab. Here's an example from one of our pediatric AIM forms. Once again, it's the items in yellow here that are copying forward from visit to visit. Now, why do we copy forward information? Well, there's a couple of different reasons. First off, it's the easiest way that we have of viewing and maintaining this historical information about the patient. We can update and edit some of this information in the patient's problem list, but that's never been very easy or time efficient to maintain, which is why we started maintaining our own lists of these on the TSWF AIM forms. Also, for some things like the problem list and the medication list, it's just a much more usable way of maintaining those. And then for items like those chronic care plans, it's really the only way we have of implementing these kind of cover sheets or flowcharts within Alta. Alright, now with all that out of the way, let's go ahead and see how the process works. When you first open up the note, which could be the day of the visit, or in many cases you'll use the open not checked in process and do it even the day or a couple of days before the visit. But you'll open up the note, you'll go to previous encounters, which will be on the folder list on the left hand side. There you're going to look for the most recent note, regardless of who completed it, that was completed using a compatible Tri-Service Workflow AIM form. I'll get to the compatible bit in just a second. How do you know that it was completed using one of our Tri-Service Workflow AIM forms? That's pretty easy. Under the History of Present Illness section of the note, you'll see the text that we've indicated by the box there. This is why it's important not to erase that text when you're completing the note. We're using that to make sure that we're finding compatible notes when we're looking through previous encounters. So what do I mean by a compatible note? Well, not all Tri-Service Workflow AIM forms can be copied forward into all other forms. There is a family of forms centered around the core, and these can all copy into one another. For example, you can copy any of the pediatric AIM forms into the core or into any of the CPG AIM forms. However, anything outside of this family shouldn't be copied forward. For example, there are forms that get used by our behavioral health colleagues, and these don't copy forward into the core AIM form at all. If you want to see the entire list of forms included within the core AIM form family, click on the button you see there on your screen. Alright, so we've now located our most recent compatible note. We're going to right-click on it and choose Copy Forward, or while it's highlighted, we can go up to the action bar and click Copy Forward. Either way is okay. Once we've done that, we need to go into the SO module. Then we want to go to the PMH tab. The PMH is past medical history, and that's the only tab that you want to copy forward. And this is important. You want to make sure that you copy forward all of it. Easiest way to do that is to click Auto Enter at the top of the screen. Once you do that, then you want to load the AIM form that you're going to be using. I'm using the core AIM form in this example. Now the first thing you want to do when you load the AIM form is to go to the obsolete terms and uncheck everything. I'll explain a little bit more about this in a little bit here. Then you want to go back to the note and verify everything that's in these yellow copy forward boxes, either by comparing it with the encounter worksheet that the patient has completed on paper or by interviewing the patient directly. That way you can make sure if there are any changes that you find them and make sure that the lists we're maintaining are up to date. Let me just do a quick discussion about the obsolete terms. We said, for example, that you can copy forward from the pediatric AIM forms into the core AIM form. Well, a lot of that copy forward data is the same when you go from the pediatric form to the core AIM form, but not all of it exists. For example, you see on the screen, there's the top section of the yellow copy forward terms, things like medical conditions, surgeries, etc., that copy over directly to the core AIM form. However, there are a number of things like EFMP, immunizations, and additional social history that are kind of key to look at when you're dealing with pediatric patients, but don't really have nearly as much to do with our adult patients that we're using the core AIM form for. So when I copy one of these notes into the core AIM form and go to the obsolete terms, you're going to see that a number of these items are selected on here. Now this is the only place on the core AIM form where you'll see these terms. However, they do end up in the note. And so what we do is we recommend every time you load up one of these AIM forms, go to the obsolete terms tab real quick. Just make sure nothing's selected on there. And if you see anything, just click it to delete it out of the note and then finish the rest of your note. Well, that's our quick tour of the copy forward process. If you have any questions, contact your local clinical systems trainer for more details.